I'm Dr. Natalie Beauchamp, and this is What the Heck, the podcast that dives into what the heck is going on in the world of health and well-being, explores how to optimize your mindset and your lifestyle, and shares practical tools so that you can achieve your fullest potential. Join me and a special guest each week as we discuss everything from biohacking to diet personalization to cutting-edge detox methods to setting and staying accountable to your goals. Ready to find out what the heck you can do to stay healthy, sharp, and at the top of your game? Let's get started. Hello and welcome to this week's episode of the What the Heck podcast. My name is Dr. Natalie Beauchamp, your host. And on this week's episode, what I'd like to discuss are the benefits of low-level laser therapy, also known as photobiomodulation. And why I decided to talk about this topic is I myself have been researching what other tools I could bring into my practice to help people with chronic pain. And low-level laser therapy really caught my attention, and after reading the research, I decided to start integrating it in my practice. And for many of you that have been listening to the podcast or know me or have read my book, Hack Your Health Habits, I think you understand how much I am all about going to the source of the problem. So let's say, for instance, somebody's got knee issues or more arthritis in one knee. The first thing we want to do is assess what's creating that irritation and that pain and look at their musculoskeletal system to make sure that there's no abnormal shifts. Adding to that I am a chiropractor by training, we have to also look at the brain and body communication. So let alone the mechanic of a joint or many joints being out of sync, if the communication between the brain and the rest of the body is impeded by not sending the proper signals to the rest of the body, we also need to address that. So I'm not suggesting that this technology should replace, everything to solve pain issues. I'm just saying that after we've looked at the cause, because let's face it, some people have car accidents and injuries and whatever, and they will need that extra help to help the body heal. And one of the reasons that I looked into this is that so many people are on painkillers. I think you almost would have to live under a rock to not know the big opioid crisis that we are facing in North America, but really right through the world. Roughly 21 to 29% of patients prescribed opioid for chronic pain actually misuse them. So it gets to be a vicious cycle. They're in a lot of pain and are taking more and more. I don't think anyone intends to start that way, but unfortunately, if a problem is not addressed and it becomes so chronic, it is debilitating for people to live with that, and it can trigger a cascade of other health issues and also overdose, which is really sad to see. So what is low light laser therapy? Well, the technology utilizes light and laser diodes to irradiate inflamed, disease, or traumatized tissues with photons. I know I'm talking nerdy here, but they're basically particles of energy that are selectively absorbed by the cell membrane and intracellular molecules, leading to the restoration of normal cell structure and function. So basically, they help the cell heal. And the process can really help increase a lot of wonderful things that we are going to talk about. So let's look here at why those waves are so important and where does laser fit into the electromagnetic spectrum, because I think we hear more and more about that. So basically, things can be put in two categories. when it comes to being non-ionizing or ionizing. Ionizing, an example of that would be X-rays, and non-ionizing would be what we're talking about here, even microwave, radio, and TV. But then we need to look at it from a non-thermal and a thermal point of view. So thermal meaning we'll be producing heat, generating heat, and an example of that would be the microwave, because we know that's the purpose of the microwave. But at a low frequency, it is non-thermal. So the technology we're talking about is non-ionizing and non-thermal, meaning when you apply it on a body part, the person will not feel the heat and will not feel anything. So this is where this technology fits in the spectrum. So how does low-level light therapy, I'll call it LLT, work? Basically, in a lot of different things, but basically into about 7 main areas. So first of all, it is going to increase blood flow. That's angiogenesis here. By increasing the oxygenated blood to the injured site or area, it will promote healing. It will also increase collagen production, so help remodel the collagen and so forth. And that's why you might have heard the laser being used from a beauty point of view. It will also help muscle regeneration and atrophy by repairing damaged muscle fiber, activating the part of the muscle or the cells to regenerate. It also is very helpful for inflammation and decreased swelling, and God knows that one of the reaction to injury is inflammation, which the body needs to do that to protect, but it will help decrease this inflammation and the mediator that are related with it, like macrophage, neutrophils, and lymphocytes, which are all part of resolving that inflammatory process. It will also help promote nerve regeneration, and that's huge because the recovery, let's say somebody has sciatic nerve injury or carpal tunnel, can really enhance that. Cartilage production as well increases the chondrocyte and the collagen production to help the cartilage as well. And the last one will help with bone formation. So there's a lot that this technology can do in terms of promoting healing. So I'm not going to go into all the physiology behind it, but basically here are certain conditions that the research is really strong on, and we might as well just go over the entire body here. So let's start at the top with the neck, obviously for neck stiffness and pain, but also can enhance with migraine and headaches. It can also help for TMJ and jaw pain, which are a lot of people do suffer from. And then it can work or help all through the thoracic and the lumbar spine for low back pain, mid back pain, for sciatica, which is basically irritation of the sciatic nerve that can go all the way down. It can help for tendonitis, golfer elbow, tennis elbow, irritation of the tendon basically. Muscle pulls as well, like a pull hamstring, shin splint, which are chronic inflammation of the anterior part of the shin, Morton's neuroma, bone spurs, Achilles tendonitis, and plantar fasciitis as well. So as you can see, it is very beneficial for a lot of different areas in the body. So like I mentioned earlier, we really want to make sure that we address the pain and the cause of the pain by going to the source and making sure that we are dealing with that. But these are all the benefits that photobiomodulation can bring and how it can speed up our healing process. Now, I know many people will have the question of how does it compare to other therapies? And I think this chart is very visual for people to understand. So let's compare it to TENS unit, ultrasound therapy, shockwave therapy, or IFC is intermittent current. So if we look at the increase in ATP production, and ATP is basically the energy or the fuel that the cell uses. And laser therapy is the only of those modalities that will actually increase ATP production. So the cell is going to have more fuel and energy to do what it is supposed to do. Inhibition of pain signaling, laser therapy and TENS and IFC do that. Endorphin release, which will help decrease the pain. Laser therapy, TEN, and the IFC do that. Angiogenesis and increased blood flow, as I mentioned, this technology does that, but so does ultrasound. And resolution of inflammation, laser therapy is great at that, but also ultrasound. But if you look at the last line, you can see that the thermal effect that I was talking about, the heat is not there. Ultrasound therapy does that as part of its treatment. So comparison of therapeutic modalities. These are some stats, some evidence-based research, how the results of using laser therapy versus TENS versus ultrasound versus IFC. So indication include commonly used application of each of those therapeutic modality. And basically, it's based on a PubMed research for all of those, and it's showing how much more efficient laser therapy is, and how much more research there is. I guess not so much the efficiency, but how much research is done on the topic as well, and if its efficiency, basically. So the one that I have chosen for my office is called the BioFlex system, and it has different protocol for different body part, but basically there's red and infrared array applied to the injured surface, and then there's a probe that will help further the decrease in inflammation and then the increase in the healing. And as I said, this is non-ionizing and non-thermal. It basically has no side effect other than using in pregnant women and over the thyroid area, but otherwise there is absolutely no contraindication or side effect, which is huge, because if we think of, as I mentioned earlier, all the people that are taking medication because they're in chronic pain. And I think chronic pain, I mean, everybody's been in a certain amount of pain from injuries or anything like that, but it goes away. But when it comes to chronic pain, it does affect someone's life to constantly be in pain. So I think if we can have tools to really help manage that, I think we win. So this was all information about the photobiomodulation or low-level laser therapy. So if you have certain aches and pains or are recuperating from an injury, or you maybe didn't address an injury, it's never too late to be able to do so. So you want to find a clinic in your area that does this kind of therapy. I mean, there's I'm sure other companies that do it, and different types of practitioners have developed different skills, but definitely look into using this technology for your aches and pain. But on another note, as you saw, it does promote healing, collagen production, and so forth. So you can also use it more from a overall wellness and optimization. This device is designed more for small areas, and that's why the technology is small. There's other infrared light technology with other companies that exist out there where they are much bigger, and you can expose pretty much the entire body or bigger section of the body. So depending on the purpose or your purpose of using infrared technology, you may want to look into different tools. So hopefully this was helpful, and you will consider that as part of tools that you can use to better your health and well-being. So until next time, this was Dr. Natalie Bosha on the What the Heck podcast.
Are you struggling to lose weight, stay energized, or adopt healthier habits? With so much information out there, it's hard to know what's best for you and your body. Not only that, but forget staying motivated when you don't have a clear path to take. That's why Dr. Natalie created the Hack Your Health Habits Mastery Program. The program is an online, self-paced, transformational program that can help you truly maximize your mind and body's potential. The best part, it's done right in the comfort of your own home and on your own schedule. The Mastery Program teaches you everything that you need to know to take control of your health once and for all. The modules are organized in a manner that is sure to keep you accountable and motivated throughout the program so that you achieve success. Are you ready to finally hack your health habits? Go to www.hyhhmastery.com to learn more.
I'm Dr. Natalie Beauchamp, and this is What the Heck, the podcast that dives into what the heck is going on in the world of health and well-being, explores how to optimize your mindset and your lifestyle, and shares practical tools so that you can achieve your fullest potential. Join me and a special guest each week as we discuss everything from biohacking to diet personalization to cutting-edge detox methods to setting and staying accountable to your goals. Ready to find out what the heck you can do to stay healthy, sharp, and at the top of your game? Let's get started. This has been a Wellness on the Go production.